Over the last 2 years, I've noticed something very fascinating. Patients are now walking in with the screenshots of their conversation from ChatGPT, or they're referencing things that they've heard on health podcasts, or they're talking about things that medical influencers are saying online. And they're asking me whether or not I can order a particular test for them, why they haven't heard of something yet, or should they be taking a particular supplement. Sometimes these conversations are just fascinating. They make me go back to the research and look at the literature, and oftentimes I learn something new. But most of the time, they leave the room a little awkward because most of us are wondering the same thing. Whether or not I am missing something important, whether or not the patient is now more informed than the doctor, and whether or not this idea sounds convincing online but hasn't proven itself yet. Today, I want to talk about why this situation keeps happening and how you can think through this yourself. It's not really about deciding who's right or wrong, but understanding how medical knowledge flows from ideas to evidence and eventually to mainstream clinical practice. Most medical ideas start with something simple, a pattern. Researchers noticed trends in observational studies. For example, they noticed that niacin can lower LDL cholesterol and increase HDL cholesterol. Then the idea is, can niacin prevent heart attacks? Researchers also noticed, for example, that people who eat foods that are rich in beta-carotene, for example, carrots or sweet potatoes, had a lower incidence of cancer and heart disease. So the logical idea then is, if we have people take supplements with high doses of beta-carotene, does that protect them even further? At this stage, the ideas make sense, but medicine has been burned by ideas that make sense but can ultimately be wrong. And that is exactly why you need to test these ideas with a randomized controlled trial. These are large experiments with thousands of patients with follow-up over multiple years. Because until you run that randomized controlled trial, you don't know how the outcomes are going to pan out. One of the most important examples of this happened in cardiology in the 1990s. At the time, cardiologists noticed the trend that some people after a heart attack developed an abnormal heart rhythm called premature ventricular contractions, or PVCs. And these patients were more likely to drop dead than those people who had a heart attack but didn't develop these PVCs. So then the idea was simple. What if we use medications to suppress these PVCs? Then people should live longer, right? It made perfect sense. Cardiologists believe this, and eventually researchers put this idea to the test in a randomized controlled trial called the Cardiac Arrhythmia Suppression Trial, or the CAST trial. More than 3,500 patients were enrolled, and the goal was simple. Let's give antiarrhythmic medications to people that developed PVCs after heart attacks and see if they lived longer. But something shocking happened. The trial had to be stopped early because researchers found that the patients that were given these antiarrhythmic medications were actually dying at a rate 3 or 4 times higher than those patients that were given simple placebos. The very treatment that seemed logical was actually killing people. Now imagine if podcasts, YouTube, and social media existed in the 1980s. You might have heard people online say things like, doctors are ignoring this one thing that could solve this problem. All you have to do is suppress these PVCs and you could save people's lives or help them live longer. Or it just makes perfect sense. And many people would have believed it, but the randomized controlled trials say something completely different. In a way, this is happening right now. For the first time in history, we're all able to listen in on conversations between doctors and researchers that typically used to happen behind closed doors. We're able to hear about mechanisms, promising theories, observational data, but these ideas are often still years away from being proven in clinical trials and being implemented in clinical practice. So when my patients are asking me about tests or treatments that they've heard online or supplements, they're typically skipping from the very beginning of the pipeline of evidence to the very end. And the end is typically where doctors operate. And so that gap between the beginning and the end makes it seem like your doctor might be missing something important, when in reality, you may be just looking at two different stages of medical knowledge. The key takeaway here is that when you hear about a new health idea online, you really want to ask yourself this one question. Where is this idea on the evidence ladder of medicine? If you look at a ladder, the bottom rung in medicine is typically observational studies or data. The second rung could be mechanistic theories. The third rung could potentially be small clinical trials. The fourth rung could be large randomized controlled trials. And the fifth rung is typically when things are now adopted by major society guidelines and adopted into mainstream clinical practice. Most of the things that you hear about online that seem shocking or new or contrarian typically are on the bottom three rungs. And the things that your doctor might be talking about are typically on the upper two rungs. It's not that either side is wrong, it's just that you're hearing about different parts of the process. If you made it this far in the video, you're probably the type of person who doesn't just want answers, but wants to understand how the system works, how medical knowledge actually evolves, how medical decisions are actually made, and how to make decisions when you're surrounded by conflicting information online. That's exactly what this channel is about. I'm going to take you inside medicine, the good, the flawed, and the complicated, so that you can understand how the system works, so that you can make better decisions about your own health. If this topic interests you, you'll probably find the next video enjoyable, where I explain something that most people don't understand. I talk about the actual differences between doctors and other medical providers, like nurse practitioners, and what role they actually play in your health. You can check that video out right here.